Let's talk about how to beat bad medical bills like a pro. Because most medical bills are wrong, there's only one right way to pay them. And you can do it in three simple steps. Before you get started, take all of your bills, all of your medical bills, and put them into two big piles. The first pile is all bills from a hospital admission. All the bills that says, okay, you had to stay in the hospital overnight, however long, 2 nights, 3 nights, a week, a month. Any bill that is from a hospital admission, take those bills and put it into one pile. Your second pile, you're going to say, okay, this is any bill that is not from a hospital stay, that is not from a hospital admission. So, ambulance services, ER bills, outpatient bills from like physical therapy. So, any bill that is not from a hospital admission, that goes in a huge second pile. And the reason why you're going to do this is because you're going to start with the hospital bills, because sometimes you can take care of a hospital bill, like make it go away without doing the three simple steps. So if you can do that, why not, right? Let's start with that. So for hospital bills, what you want to make sure you do is apply for financial aid or financial assistance or charity care. All hospitals in the United States have charity care or financial aid or financial assistance. The difference is there's a group of hospitals that have to offer it, and there's a group that does it because it's so financially lucrative for them to do so. So let me explain. Most hospitals in the United States are nonprofit facilities. And nonprofit facilities, by federal law, have to offer sliding scale income based discounts for those in the communities in which they operate. That's just a fancy name for charity care, financial aid, financial assistance. Every nonprofit facility in the United States has to offer the application to everyone. If it's a for-profit facility that you received your services, you still want to apply because many for-profit facilities will get such a huge discount on their taxes that they pay that they have generous, sometimes as generous, if not more generous, applications or sliding scale income-based formulas compared to nonprofit facilities. So no matter what, apply first. Apply for a hospital application for their sliding scale income-based discounts. Before we get to the three simple steps of how to deal with bills that are not hospital bills, I just want to say this one thing. I want to share this one story about why it's important that you apply no matter what for financial aid, financial assistance, charity care for every hospital admission. There was a young woman who had to have emergency surgery, and she said, I really can't afford this. This bill is $10,000. I don't have it. What am I going to do? And I explained to her, I said, the first thing you're going to do, instead of figuring out what the bill is it fair, what your insurance wanted to pay and didn't pay, what felt was medically necessary or not, before you get into all that, the simplest thing to do when it comes to hospital bills, the first thing you're going to do is apply for financial aid. And she says, well, you know what? I have a 6-figure income. There's no way I'm going to qualify for any discount. I said, you know what? Just apply, because every hospital is different. Every hospital has their own formula. The federal law says you have to give everyone in your community a formula for income-based discounts. It doesn't say what that formula has to look like. It could be, well, we don't give discounts for anybody who has insurance. Or it could be like, well, if you're 200 times the poverty rate or 300 times, it's arbitrary because the federal government doesn't make a requirement for hospitals to say what that formula is. So they all make it up. You can have two hospitals in the same town and they have very different formulas for their income-based discounts that they offer if you meet their formula, their criteria. So always apply. So she comes back and she says, this $10,000 bill, I'm thinking because I make like almost $150,000 a year, I knew there was no way. But she says, they wiped away the whole bill. I owed nothing. And I said, that's why you always apply. You never know because the formula is different for every facility. So please always apply. Now, how do you beat bad medical bills like a pro for any bill that's not a hospital bill? That's where you have to do the three, fortunately, simple steps to get this done. The first step is to ask for a real bill with CPT codes. CPT codes are to medical services what barcodes are to products in a retail store. Every product, every service has their own unique CPT code. So there's a different CPT code for an ER level 1 visit compared to an ER level 4 visit. There's a different barcode for a certain brand 8-ounce size water bottle compared to the same exact brand 16-ounce bottle of water, right? So what they're doing is describing what the service is, and that tells insurance companies people are going to pay for it, what they're paying for. You wouldn't pay for something if they didn't tell you what you're paying for. You scan your bottle and it just says, hey, this is the amount. Well, they're telling you what it is. You know what it is by looking at it. If it's a product, because you know what the product is. When it comes to medical services, the only way you know what it is by if you get a description. And that's what you're getting with the CPT code. Ask for a real bill with CPT codes. And so the question is, well, how do I know if I have a real bill, or how do I know if it's a CPT code or not? Unfortunately, most bills that are sent to patients are not bills with CPT codes. They're not real bills. I call them wishing lists because they're wishing and hoping and praying you'll fall for it. It is what it is. That's the system that we're in. They know that most of us don't have basic medical financial literacy, meaning we don't know that we have to ask for a real bill with CPT codes. We just think because we're trusting, we love our nurses, we appreciate our docs, we're just trusting that it's accurate. No, the medical care that you receive is a different universe than the back office, than the business office. You have accountants and private equity folks who are just there to make money. So it's very different. It's a different world than the providers that you're dealing with who's saving your life and taking care of you and yours. So that's why you have to be vigilant and ask for a real bill. And let me tell you, insurance companies, they only know what to pay by the CPT codes they get. If a claim didn't have CPT codes on it, an insurance company would ignore it. There's like, what do you want us to do with this piece of paper? This has nothing to do with anything. I always say, if you have to ask why would providers send patients different bills? Why would they only send real bills most often to insurance companies and not to patients? Why? Follow the money. It's because it works. We tend to fall for it. But you're not. You're going to, like a pro, ask for a real bill with CPT codes. Well, what does a CPT code look like on a statement, on a bill? I call them statements because often they're not real bills. So why do I call it a bill? I call it a statement. You're going to look at your statement you get, and it'll say date of service, the date that the services you received. And sometimes it'll say CPT or CPT/HCPCS. HCPCS is a subtype of CPT coder, or it'll be 5 digits, even if it doesn't have something at the top. And you're going to plug that into step 2. When you're plugging that into step 2, you're saying you're going to plug it into, I used to say a Google search, but that takes so much time compared to AI platform searches. It pops up quickly. So if you're not sure it's a real bill, if the numbers there are 5 digits or more than 5 digits, and you're not real sure, plug it into an AI search and AI platform or medicalbillrelief.com. And if it's a real CPT code, a description and/or in medicalbillrelief.com, the fair price will pop up. If gobbledygook comes up in your AI search, or you get gobbledygook from the medicalbillrelief.com when you upload the bill, then you know it's not a real CPT code. You're going to have to call the provider's billing department and ask for, quote, something with CPT codes, unquote. Pro tip, what I'm finding what's most helpful and fastest is that when you call and ask for a UB-04 form, that just cuts the chase. It just lets the billing office know, the person on the other end, that you know what you're talking about, that you're asking for something with CPT codes. So UB-04 form is what's sent from the provider to insurance companies. So they all have CPT codes, so the insurance knows what they're being asked to pay for. That's why it's important to get step 1 critical, because that's where the money is. CPT codes is where the money is, right? So there you go. Step 1, call, ask for a real bill with CPT codes. While you're waiting for that CPT code form, UB-04 form, or something with CPT codes to come to you in the snail mail, as soon as you hang up with the billing department, if you have insurance, grab your insurance card, flip it to the back, and call the customer service number on the back and ask for an EOB for that date of service. Call them and say, hey, did you get a claim for date of service, la, 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 from such and such provider? And can you send me the EOB if so? EOB is an explanation of benefits. If you're going to use insurance for paying for the service that you received, by law, the provider has to send it to your insurance company and the network they participate with. If they're in network, meaning in network, they take your insurance. They have to send it to the insurance company for claims, for payment or not payment, whatever they're going to do. They have to submit it to them first before you can be asked and expected to pay. That's why when you have insurance, it's a big deal to say, okay, is this bill that I received, is this before insurance or after? Now, if you have insurance, there's a caveat. I want to give you a heads up. Another pro tip is 70% of us in the United States with commercial insurance don't meet our annual deductible in an average year. And all of the insurance companies know this. So an annual deductible is what you have to pay before the insurance pays. Your insurance policy will pay in. And what that means is, it's annual. So that means clock strikes midnight, right? December 31st into January 1st, New Year's every year. I often say 70% of us in this country are effectively, as of midnight, January 1, effectively uninsured because the clock starts again. We have to meet our deductible, meaning we pay first before the insurance will pay. So this is a big deal. You want to decide, you know what, this is a one-time thing. I don't think I'm going to meet my deductible with services. It's not a chronic condition. I don't think I'm going to have to come back. 70% of the time, every year, we don't. 70% of us don't. If you're pretty sure it's going to be an average year, then don't ask for it to be submitted to your insurance company. Say you're going to pay cash. That's step one, getting that real bill with CPT codes so you know what you're paying for. Then when you get the CPT codes, the real bill, you're going to go to step two, which is taking the bill and you're going to upload it to medicalbillrelief.com, and up will pop the most fair retail rate for the medical services you received. If you don't want to go to medicalbillrelief.com, you can take each code from that real medical bill and plug it into an AI search. Whatever AI platform you want to use, ChatGPT, Perplexity, it doesn't matter. I think ChatGPT probably may have more up-to-date real-time database. That's what I would suggest. It's fastest compared to doing a Google search and plugging in and bumping around. Plug in each of those CPT codes because you're looking for two things. Number one, a description of the services you receive, what that CPT code describes. And why that's important is you want to make sure it sounds like what you actually got, that you're being asked to pay for services you actually received. You went into the ER because you were severely dehydrated from vomiting. You're going to make sure you got an ED level CPT code for ED level, emergency department level 1, as opposed to level 5. You'd be surprised at how often this happens. Our former Surgeon General had this happen. He was away out climbing and hiking or doing something in that great outdoors, and it was really hot. Someplace it was far away from home, visiting on vacation, and he rolled in needing hydration. He needed IV fluids. And he gets a bill for ER or ED level 5 care. ED level 5 is like the highest, most critical care, like the person is dying or dead and they're trying to revive them. Like they're not breathing. They have to be put on a breathing tube, or they have to be shocked, or severe, severe trauma injury, that kind of thing. So that's why you want to make sure that the CPT code sounds like the services you receive. And number two, what you're going to do is find the most fair retail price for the services you receive that providers accept in this country, in the United States. That is the Medicare rate. People say, well, gosh, why are we talking about Medicare? First of all, I'm not old. Medicare is for old people, and I don't have Medicare. And what if they don't accept Medicare? So Medicare is, yes, for people over the age of 65 who don't have health insurance through an employer, and or for those who are much younger but have certain chronic conditions. So what I tell people is, you know what? Insurance companies negotiate really low discounts, as low as they can get from providers for their patient population, their members. Medicare is the federal government's insurance. You have the federal government, you live in this country. The federal government has negotiated these rates for you. Just because you don't have Medicare and they don't accept Medicare doesn't mean you have to pay made up frivolous numbers, prices, rates. What I call MRSP, manufacturer retail sticker price, because the MRSP for medical services providers, institutions make up so they can pitch to insurance companies that are negotiating for their members, hey, look, this is the huge, huge discount we're giving you and your members. The federal government did this for you, for its citizens. Why can't you use the same numbers? It's the most fair retail price that most providers will accept in the United States. Whether or not they take Medicare insurance, you know that that's a fair rate. Now, some people will say, well, we're not sure that's a fair rate because you get pushback, the providers say. If everybody paid Medicare rates, we would go out of business. Well, there's statistics that show, studies that show that's not true, but let's just say that it is. Many people who do this work say, okay, we'll offer 2 times Medicare rate. So when you go to medicalbillrelief.com and upload your bill, what will pop up as a fair rate to offer providers for services you received, or what's a fair rate for them to ask for payment for the services you receive, is 2 times the Medicare rates. That automatically goes in. You don't have to calculate that number, double the number. Is this a fair rate or not? It already comes up in medicalbillrelief.com when you upload your bill. So that's step 2. Once you get a real fair number for the services you receive, you're going to call back the provider in step 3, and you're going to say, quote, I received a bill for $10,000. In my case, I am willing and able to pay $3,000. Who can I speak with who can help me make a payment plan? Unquote. Now, I really want to remind folks, when you call and say, in my case, I am willing and able to pay whatever that Medicare number was, that number you came up with in medicalbillrelief.com or in your research, in your AI search, don't say, hey, the fair Medicare rate is this, because you're inviting them to just get rid of you. We don't accept Medicare. You don't have Medicare. They don't need to know that. And that you're just giving them an excuse not to talk to you, not to negotiate with you. So with your automatic negotiation, you're saying, hey, this is the fair retail rate I'm willing and able to pay that I can afford. Now, if you're not able to pay the entire amount by the end of the month comfortably in just one payment, you're calling and you're asking for an interest-free payment plan that's in your budget. And there you go. What you've done is automatically negotiated without negotiating. You beat a bad medical bill like a pro. It's your money. Protect it. Visit medicalbillrelief.com and check the notes below for more support.